BingX, a trusted global crypto exchange. Trade spot, futures, or copy top traders easily. Sign up via the link or referral code to get 30 USDT instantly, plus up to 1,500 USDT in bonuses for verification, deposit, and trading.
Up to 300,000 Australians could face lengthy waits for crucial in-home aged care services by the year 2030, according to stark new projections based on Australia's recently revamped aged care system. Expert modelling, meticulously crafted by Professor Kathy Eager, a distinguished former advisor to the Aged Care Royal Commission and a respected UNSW adjunct professor, paints a concerning picture of escalating demand for in-home support packages. These packages are a cornerstone of the Labor government's ambitious overhaul of the National Aged Care Framework, a system now scheduled to officially launch on November 1, Professor Eager's analysis, which leverages robust data from the Australian Bureau of Statistics concerning population trends and intricate waitlist projections, indicates a significant deficit. By June of next year alone, a shortfall of over 171,000 places is anticipated, translating to an unmet demand of approximately 31%. The situation is projected to worsen considerably as the decade progresses. The current waitlist, which has seen a consistent annual increase of around 30,000 individuals, is forecast to balloon to more than 301,000 by June 2030. This alarming figure represents a projected shortfall of nearly 44%, underscoring a systemic challenge in meeting the growing needs of the nation's elderly population. These projections cast a shadow over recent federal budget allocations. Figures embedded within the 2025-26 federal budget papers reveal a substantial 27% surge in spending allocated to residential aged care. In stark contrast, the investment in new support at-home packages over the same four-year forward estimates period shows a remarkably modest increase of just 0.3%. This disparity in funding priorities raises significant questions about the government's preparedness to address the anticipated demand for home-based care. Further evidence of the strain on the current system emerged last week during Senate estimates hearings. Documents tabled at these hearings disclosed that at the close of September, nearly 122,000 individuals were actively on the national priority system, anxiously awaiting a home care package. This number represents a concerning escalation from the 96,709 individuals on the waitlist at the end of June this year, a jump of over 25,000 people in just 3 months. Professor Eager has voiced strong concerns about the imminent transition to the new system, originally slated for a July 1 commencement but subsequently delayed to allow the sector more time for implementation. She has characterized the situation as facing a rough start, highlighting several critical issues. The 2025-26 budget shows no growth beyond June 30, 2026, for support at home, Professor Eager stated, emphasizing that the waitlist itself has surged by a staggering 26% in a mere 3-month span. Moreover, she pointed out that approximately 10% of all public hospital beds across Australia are currently occupied by patients who are awaiting placement in aged care facilities, a situation she believes the government is failing to adequately recognize or address. In response to these mounting pressures, Professor Eager has aligned with a coalition of groups, including the community organization Meals on Wheels, in a unified appeal to the government. They are urging the government to maintain the existing Commonwealth Home Support Program, which provides essential entry-level care for seniors in their own homes, before it is fully integrated into the new system. This program is considered a vital safety net for many elderly Australians who rely on its services for continued independence. Penny Allman-Payne, the Greens spokesperson for aged care, has echoed these concerns, asserting that the Labor government has not allocated a sufficient number of new home care packages. She issued a grave warning that elderly Australians will continue to face prolonged waits, potentially losing their lives while awaiting essential assessments and the commencement of care packages. It takes over 6 months, in many cases, for people just to get an assessment, to get care, and then when they finally do get assessed and they think that they're at the point where they're going to get the help that they need, Ms. Allman-Payne explained to Guardian Australia. Then they can be waiting up to 12 months and sometimes even 18 months then to actually get the care. That's devastating for people. This sentiment underscores the profound human cost of systemic delays. It is worth noting that Ms. Allman-Payne played a pivotal role in brokering a crucial Senate deal with the Greens, the coalition, and Independent Senator David Pocock. This bipartisan agreement successfully compelled Labor to expedite the release of an additional 20,000 home care places, which were brought forward in July. However, the urgency of the situation remains paramount. Ms. Allman-Payne stressed that a vulnerable individual in their 80s should not be subjected to waiting periods of 6 months or more for essential care. She highlighted the detrimental consequence of these delays, stating, "It means that people are forced into hospital when they don't need to be, and we've got state health ministers telling us now that there's a couple of thousand people in hospital beds around the country who are older people who are not unwell." This indicates a significant inefficiency and strain on the broader healthcare system, with aged care backlogs contributing to hospital bed blockages. In response to the escalating concerns, the Minister for Aged Care, Sam Ray, has stated that the Albanese government is actively engaged in addressing the growing demand within the aged care system. "Our government is embarking on this once-in-a-generation reform to ensure every older Australian can get the care they need, when they need it," Minister Ray asserted. He acknowledged the rising demand for in-home care and reiterated the government's commitment. "We know demand for in-home care is on the rise, and that's why last year the Albanese government committed to add an additional 300,000 home care places into the system over the next 10 years.